Good evening, everyone. My name is Alex. I'm the nursing administrator at the Owyhee Community Health Facility. I am here to give a presentation for the Duck Valley COVID Prevention Workshop, June 21st, 2002. I will make a quick mention that I do apologize for not being able to be there in person. But full disclosure, I am home on isolation with COVID-19, so if I'm clearing my throat or taking a pause to drink some water, that's just so I can get through this presentation. I did struggle with whether or not I was going to disclose that information, but I think it's important as a healthcare professional that we advocate and encourage honesty and also following quarantine and isolation rules. This is just a quick note about conflict of interest, so I will read this aloud. Any products listed or talked about in this presentation are simply examples. I don't have any conflicts of interest to report for this presentation. While I may name specific products or medications, I am not paid by any of their companies or parent companies and have no biases towards one product over another. Here's the outline of what we're going to talk about today. We're going to talk about prevention strategies, symptoms, testing and testing requirements, quarantine and isolation, treatment options, and then I will give my contact information at the end. Little introduction about me. I'm Alexander Vitale. I go by Alex. I am the nursing administrator at OCHF. I've been a nurse for 10 years, 5 as an LPN, and the last 5 as an RN. Most of my career, I have worked in long-term care and skilled nursing facilities, but I have been honored to have been working at the OCHF for almost the last year and a half. Yeah, even though I started as a clinic RN, I have been the nursing administrator for most of my tenure there. I received my associate's degree in nursing in 2017, my bachelor's degree in 2018, and I'm currently enrolled in a master's in business administration with the healthcare management focus program. So according to the World Health Organization, COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. Now, I am not a scientist or microbiologist. I think it's important to just say it plainly. It is a respiratory disease, and it is spread through respiratory droplets. These droplets don't have to be visible. When we breathe, talk, sing, we spread microscopic or invisible to the naked eye droplets. We don't have to be coughing or sneezing to be contagious to others if we have COVID-19. Some prevention strategies. This is to keep you from getting COVID-19, but also to keep you from spreading it. If you ask any healthcare professional, they will tell you hand washing is the single most important aspect of infection control. Now there's some instructions there on how to wash your hands. I won't read them word for word, but there is a diagram in the middle of this page that kind of shows they're getting in between their fingers, they're getting up their wrist, and they're getting under their nails. Those are important aspects that many forget to do. It's also important to make sure that you get a good lather and that you are rubbing your hands together for at least 20 to 30 seconds. And then on number 5 there, it's really important to use a separate paper towel if you're in a public restroom to turn off the faucet or open the door after you wash your hands because there is high risk for cross-contamination. As for hand sanitizers, it is an alternative to washing your hands. It's just important to make sure that your hands are not visibly soiled, because that does require running water and, soap to effectively wash that off. Also, make sure you get a hand sanitizer that's at least 60% alcohol. Most of the hand sanitizer in the market today is about 70%. Cover your mouth. So you should always cover your mouth when you cough or sneeze. A lot of people, including myself, will cough into the inside of our elbow. Back in the day, people used to just always cough into their hands, but they don't think then you're going to touch something. So if you do cough into your hand, or if you use a tissue to cough or sneeze, you should wash or sanitize your hands afterwards. Getting vaccinated. We do have 2 vaccines currently available at OCHF, Moderna and Pfizer. Moderna we have for 18 and older. Pfizer we have for ages 5 and older. We do have several days during the week that we administer different variations of those vaccines. Now, one thing I am excited to mention is that today, because I'm recording this a day in advance, on June 20th, the IHS has approved, following the CDC's approval, to administer Pfizer and Moderna to children ages 6 months and older. So everybody, essentially, 6 months and older is eligible for the vaccine. Once it's available at our clinic and we have more information, we will be sure to advertise on Facebook and put up flyers in the community to let you guys know when you can get that scheduled. Stay home when you're sick. Excuse me. It's very important to stay home when you're sick, or if you have symptoms of any kind, whether it's COVID, a cold, the flu. It's not worth the risk to yourself because your immune system may be compromised because it's busy fighting off something else that you might not be able to fight off another illness. It's also not worth the risk to expose other people, including our children and elderly in the community. Everyone knows the symptoms of COVID-19 by now. Here's the list: fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, a new loss or taste of smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Now, this is not a complete list. If you have any other symptoms that are abnormal for you, or if you just think it's allergies, it's better safe than sorry and go ahead and get tested. Now, the testing that we have is the Abbott ID Now analyzer. It does a nose or a throat swab analysis. Historically, we have done nasal swabs, but we will be transitioning to throat swabs starting next week. This is because the recent Omicron variant is more likely to show a false negative when done in the nose because the virus is being found more in the throat. Now, we want our patients to be comfortable, so we will offer it a nasal swab if it's requested, but just know that it may be a false negative and you may be positive and put other people at risk. The other thing we're changing is we'll be having criteria following the CDC guidelines of when we should be doing testing. So we will only test you if you have COVID symptoms, if it's been at least 5 days since you had an exposure. We have a lot of people that call the day of or the day after, say they had an exposure and they want to get tested. but that's really too soon for the analyzer to tell because there hasn't been enough of the virus to build up in your system. For screening requirements, for school and sports, and things like that, before and after traveling, especially out of state or out of the country, or if it's recommended by a healthcare professional. I'm going to skip this, the rest of this, what you should do if it's positive and what you should do if it's negative, other than if it is negative and you have symptoms, or if you've had an exposure and you are not up to date on vaccines, you still need to quarantine for 5 days. We do not do testing to get people out of quarantine or isolation because of that risk for false negative tests. Now, when do you quarantine or isolate? If you've been notified you came in close contact with someone who tested positive for COVID-19, you have been potentially exposed to the virus. And for this definition, close contact is within 6 feet for 15 minutes or longer in a 24-hour period. So if you were around somebody for 10 minutes and then 3 hours later you were around them for 10 minutes again, that would be considered an exposure. Also, if you come in direct contact with somebody, regardless of the duration, like a hug, a kiss, or a handshake, that's an automatic exposure. As for isolation, if you've tested positive for COVID-19, regardless if you have symptoms or not, then you are put on isolation. Some people test positive and don't have symptoms, but they may still be contagious. So what do you do when you're on quarantine or isolation? They're both pretty similar. You're going to stay home and stay away from other people. For quarantine, you'll monitor for symptoms. If you develop symptoms, you'll get tested and you'll isolate until you get your test results. If you have any difficulty breathing or chest pain while you're in quarantine or isolation, or in general, any day of the week, if you have difficulty breathing or chest pain, you need to call EMS 911, or if you're calling from a cell phone, call 775-757-3624, and that will get you directly to the Owyhee dispatch to get EMS dispatched to your location for an evaluation. We do recommend anybody with an oxygen saturation of less than 90% go to the hospital for further evaluation and treatment. For isolation, excuse me, it is like quarantine. It's just a little more stringent. You don't want to share any household items. You want to stay in separate bedrooms and use a separate bathroom if you're able to. But, those of us, not only here on the res, but other rural communities and even all throughout the United States, we don't always have a separate bedroom or bathroom. So if you're not able to use a separate bathroom, make sure you get the disinfectant supplies from the EOC or the contact tracers to be able to disinfect after use. Also, as far as the bedroom goes, it is preferable that you separate if you are staying in the same bedroom as someone else. That may not be possible, but it also may extend your spouse or loved one's quarantine period because their 5-day official countdown won't start until after your isolation is over. So they may have extended quarantine periods if they're not able to separate. Otherwise, if you're in common areas like the living room, you want to try to maintain a 6-foot distance and wear a mask when you're indoors and around other people. If you are up to date, which means you have received all of the primary series and booster doses of the COVID vaccine that you are eligible for, or if you've tested positive in the last 90 days, you do not have to quarantine. Instead, you will monitor for symptoms and wear a well-fitting mask when you're around other people for 10 days and get tested at least 5 days after your exposure. And as far as isolation, if you test positive for COVID-19, you will be placed on isolation regardless of your vaccine status. This one we just talked about. So it is 5 days after exposure or 5 days after your positive test. To get off of quarantine or isolation after the 5 days, as long as you don't have a fever and you have not used fever-reducing medication like Tylenol or Advil, and your other symptoms have improved, then you may be released from quarantine or isolation. Now, if you're taking cold medicine to treat your symptoms, many of those contain acetaminophen, which is essentially Tylenol. So you would need to be off of all medication that contains Tylenol for at least 24 hours before we can determine whether or not you're fever-free. Another note is the 5-day count. There's a lot of misinformation or misunderstanding about the 5 days. So the day that you test positive, or the day that your symptoms start if you tested positive, or the day of your exposure counts as day 0. So the next day is day 1. So for instance, if you test positive on a Sunday, which you wouldn't here because we're not open on Sunday, that was a poor example, Monday would be day 1, Friday would be day 5, and you could be released as early as Saturday. So it's essentially 6 whole days. Treatment options. So Paxlovid is currently the most used at OCHF. It's an oral antiviral. It can be given to COVID-positive adults and children aged 12 and older who are high risk for hospitalization and death. It must be given within 5 days of symptoms starting. There's also a couple others. Remdesivir is for the treatment of COVID, and it needs to be given within 7 days of your symptoms starting. And there's Evusheld, which is a pre-exposure prevention for those ages 12 and older. It contains 2 monoclonal antibodies to help prevent COVID-19. The Evusheld is 2 intramuscular injections, just like the vaccines are, but they are both given at the same time. Both Evusheld injections are given at the same time. A lot of people will call and say, I tested positive for COVID and I need medication. Most people don't need medication. They can rest and hydrate and successfully get through their isolation period and recover from COVID-19 without medication. But if you are interested or curious about whether you should get vitamins or supplements, Paxlovid, or any other medication, go ahead and call us at OCHF at 775-757-2415, extension 4226, and ask for the nurse for more information or to be triaged. Basically, we'll ask you about your symptoms and your risk factors to determine if you need to see a provider. If you just want to make an appointment and come in to discuss treatment options with the provider, or you are concerned with symptoms that you have, or if you have not recovered in the time frame that you expected, you can go ahead and call extension 4221 and ask for an appointment with the COVID provider. If you have high risk for complications, such as being elderly, immunocompromised, have had an organ transplant, diabetic, COPD, the provider may order medication for you after a phone consultation and reviewing your medical record. If you don't have someone that can pick those up for you, we can usually deliver them to your house. Either EOC, the contact tracers, and our community health department can drop those off for you. If you need that service, give us a call and let them know at extension 4221. Or you can contact Community Health at extension 4258. Here's my contact information. I've included my work email. It's my last name, vitali.alexander@shopi.org. Or you can call extension 4226, that's the nurse's desk, and ask them to page me. And if I am available and in the building, then I will take that call. Otherwise, they will take a message, and I will call you back as soon as I can. If you send me an email, I do ask that you keep the information, your personal information, limited, because email is not HIPAA compliant. It's not a secure method of communication. So if you want to just give your name and a brief description of your symptoms, or if you have questions about the COVID vaccine or other treatments, you can include that information. I check my email regularly and will respond as soon as I can. Otherwise, if you would like to talk to me in person, or you just want to meet me face to face, you can visit us at the clinic at 1623 Hospital Loop. These are just a couple pages of references. Most of the information I had already either knew or had experience with over my 2.5 years of working with COVID patients, but I just wanted to make sure I had the most up-to-date information and was giving information that followed medical guidelines and recommendations from the CDC. And there's the cute little origami bird. I want to thank you all for your time and attention. It is truly an honor to have been asked to present during this event, and I do apologize for not being able to be there, but I want to make sure that I'm keeping myself and the community safe. I look forward to hopefully returning to work later in the week, and like I said, I will be checking my email, so if you have any questions, shoot me a message or give me a call at the clinic and leave a message with one of the nursing staff. That is it. That's all my time. Thank you, and you guys have a safe rest of your week.